Wave Country, I'm John Ramsey, and welcome to the Wednesday edition of Wave 3 Listens Live. Today we're going to talk about first impressions. Everyone is always impressed when you have a pretty smile, and that's what we're going to bring you today with Freedom Mini Dental Implants. With us now is Dr. Regan Ackerman. Dr. Ackerman, welcome back to the show.
Hi, thank you. Hello.
All right. You and I are having a discussion about the importance of a smile, and it really does go deeper than a pretty smile, although there's nothing wrong with that. But it really is about quality of life, isn't it?
Definitely.
I mean, it really is.
Yeah, it's not, everybody wants their pretty smile, and that's
Sure.
great. Not, but a lot of what we do is just help people gain that confidence to be able to eat and chew again and do what they do. And the biggest person we kind of help is the denture wearer out there, the one that's struggling wearing their dentures, or they don't go out of their house, or they don't want to go out to eat because their denture's moving around, flopping around, and they just want to be able to eat and chew and smile again. But you're right, it's not always just about aesthetics. It's, mentally, and giving that confidence back to yourself that you can eat what you want to do and go out in public and not have to worry about your smile and your teeth.
Yeah, it's a true life changer. It really is. And we're going to show you an example, but before we do show you that example, I want to talk a little bit more about exactly what you do and why it's different from the former method. Often when you or Dr. Stroud come on the show, we talk about the differences in the way that your business has evolved.
Yes.
I mean, formerly it was a lot of surgery, a lot of expense,
yes,
and things have gotten not only less invasive, but also less expensive. I mean, it's all good, right?
Right. So yeah, no more going to the surgeon, no more incisions, no more stitches, and a lot of times a lot of our patients were told they had to have bone grafts or sinus lifts and things like that. And we don't have to do that with the mini implants, because we kind of always say we don't need a lot of bone, we just need some bone. But yeah, it's less healing time, it's less invasive, less costly, a lot of things, just the advancements of the mini dental implants that a lot of people aren't aware of yet. So.
Dr. Ackerman, I've talked to Dr. Stroud about this, and I want to ask you the same question. So for you were practicing like him, you were both practicing general dentistry,
yes, when
you discovered mini dental implants.
Yes.
So, and you're smiling.
Yeah.
Because it's a game changer.
It was life-changing for me, not just my patients, but for me as a dentist, to be able to give people this option. I think I mentioned it to you before. I was probably like a ton of other dentists and would, try to help people save their teeth as long as possible, but sometimes I knew I'm going to have to tell this patient they need to have their teeth taken out and do dentures, and that was the only option I had for them, or to go the surgical implant route, and they couldn't either afford it or didn't want to go through that long process and surgery and things like that. But when I discovered the mini dental implants, I was like, got a perfect solution for you, or we don't have to make you that partial anymore. We can replace teeth at an affordable cost for you with these mini dental implants. And so it just made me a better dentist, and to give somebody a much better option, to be able to, if they do have to have their teeth extracted, to give them something I'm confident that will work for them and let them smile and chew again.
Yeah,
so.
Without all that painful, extensive surgery, and also less expensive, there's really no downside. All right, I love when we do the before and after pictures, because the proof is in the pudding.
Yes.
So today's patient is John, correct?
John,
Tell
yes.
me a little bit about John.
So John is actually a really interesting patient. He's an awesome guy. So he actually came to me. He had already been through the process of having 2 surgical implants placed on the bottom. So he had dentures, and he thought, I'm going to get these surgical implants and my life is going to be great, my dentures are going to stay in. And he came to me and was like, my dentures are still loose, I hate these, I've spent all this money on surgical implants, on getting this denture made, and I'm still not happy. So he came to me, and I was like, we can help you. So we did snap-in dentures for him on the top and the bottom with the mini dental implants, able to get it, way more affordable for him so that he could do the top as well, because he already had been through that, and he knew. He's like, I can't afford surgical implants, I can't do it on the top, and we were able to help him and get, in his budget where he could afford to do snap-in dentures on the top and the bottom, and and he's happy as ever.
Yep.
They stay in now. He can chew and eat and smile, and he's really, really happy. So,
congratulations to you,
yeah.
John. There you go. Okay,
Yeah.
let's talk about, there's a couple of procedures that you offer. One, John had, which is to enable dentures to stay in more secure, correct?
Yes.
So that there's not all the glue and all of that, and that's fantastic.
Right.
And there's another procedure, right, that involves permanent teeth. I mean, there's no plastic, there's no dentures. It's like having a brand new set of teeth.
Right. We kind of say it's the closest to getting your natural teeth back as possible. It's like a third set of teeth for you, where they're cemented in, and I can kind of show that model right now.
If you don't mind showing us whichever one you want to do first.
Okay. We'll do kind of the permanent teeth first. So this is our model. So imagine, this is your mouth without teeth, and these are the little mini implants, okay?
And there would be no plastic here, right?
No plastic. Yeah, no plastic. So when we do the mini implants, I mean, like I said, no incisions, no stitches. I don't have to put you to sleep. I mean, literally, you'll walk in. You can walk in and out by yourself. Nobody has to drive you. I'm just going to numb you up a little bit. A couple little pinches of Novocaine, okay? And place these mini implants. There's no bleeding, no swelling, anything like that, okay? And then with the permanent teeth, we're able to get rid of the denture completely. So
you custom make some teeth?
No custom make teeth, porcelain, nice pretty teeth. It won't cover the roof of your mouth anymore, so you can taste your food again, which is great. But then this is just going to cement on and glue on, and it stays in your mouth permanently. So it is not coming in or out, and it is sturdy, and you can eat whatever you want to eat with this. And like I said, no bulkiness of the denture anymore. It won't cover the roof of your mouth anymore. This is kind of the best thing we do for patients, and it's just awesome.
Yeah, and they get a little irrigator to clean. So really, it's just like having your own teeth again. I would think that patients, your work must really be rewarding, because I would think that patients are like, wow, this is truly...
It's life-changing.
Yeah,
it is. So, yeah, definitely. They don't have to worry about, ordering at a menu anymore, scanning the menu, what they can eat, what they can't eat. No more carrying denture glue in their pocket, and having to excuse themselves to the restroom and taking it out, cleaning it, and trying to figure all that out. So, yeah, it really is life-changing. It's funny, when we do this, we kind of joke, but we see patients back, and then they'll be like 5 or 10 pounds heavier because they can just eat again. They can do what they want to do.
That's a good thing. That's healthy weight gain.
Exactly.
Because there's a lot of healthy foods that you can't eat if you're a denture wearer, or you probably have trouble eating, and that would be, the nuts, steak, vegetables, raw vegetables, apples, fruits, things that are really good for you as far as fibrous that you cannot eat, right?
Yep, and just nutrition and being able to chew that food up is really important just for your overall health and nutrition. I've seen some patients that, one patient said she basically knew she had eaten pretty much sugar as a diet, because it was kind of the only thing she could eat, sugary foods, and because she couldn't chew her food, and she kind of became diabetic from that. So being able to chew your food is really important, nutrition-wise, overall health-wise, to get the nutrients that your body needs.
Yeah, the nutrients and helping your digestive system and all of that.
Definitely.
All right. If you have any questions, and we'll show you a little more, maybe just a tooth or two. So in the next segment, we'll talk about helping you out as far as if you have a tooth here or there. We'll talk about age parameters. By the way, there are none, really.
Right.
But we'll talk about all of this. And if you have a question, 571-5362. Is that right? 571-5362. Give us a call here. 5263. Wow, my mind is everywhere. 5263, 571-5263. Give us a call if you have any questions at all about either one of these procedures. And again, we'll talk a little bit more about it. Maybe you have a tooth or two, or you're just not comfortable with your smile. Less invasive, less cost, and not the hassle. It's fantastic. Again, that's Freedom Mini Dental Implants. We'll be back with more with Dr. Ackerman next on Wave 3 Listens Live.
When you're doing 71 live sporting events outside, you pretty much rely on the weather. It's important to have accurate weather information, like the weather information we get from Kevin Harnett and the Wave 3 weather team.
Here's the current radar view.
If you don't have the Wave 3 weather app, you need to get it because it's something that I live by each and every day.
We just got a lightning push notification from the Wave 3 News weather app right here in downtown Louisville.
So when you're making plans, especially plans that involve being outdoors, it's something that you can rely on.
A message from attorney Michael Sullivan about disability benefits.
Have you applied for disability and been denied? Sometimes what's wrong with you, it's just not obvious to a judge. Ever wonder, how do you prove your pain is real? It's not like the judge can see right through you. I'm attorney Michael Sullivan. I've handled disability cases for over 25 years. I will help that judge see not just who you are, but what it's like to live inside your body.
Call 1-888-587-0228. Call now.
Welcome back. Mini Dental Implant Center. Dr. Regan Ackerman is with us. That's Freedom Mini Dental Implant Center. I want to make sure I have that right. Freedom Mini Dental Implants. Give them a call today. Let's talk a little bit about the other procedures. We talked about permanent teeth, which is fantastic and life-changing. But for those denture wearers out there who really struggle with all of the glue and being able to eat the food you love, this can happen for you as well. The second procedure, if you would.
Yep. So this, the other thing we do is what we call the snap-in denture. So kind of similar, if you want to,
there we go,
to the other one. We just, you know, we don't put as many implants in. And this procedure and the one I showed before can be for anybody. You know, if you're wearing a denture, you can get the permanent teeth or the snap-in denture. But same thing, placing the mini implants, okay? No stitches, no surgery, none of that, okay? And the kind of the really nice thing about this snap-in denture here, right here, is the day we put the implants in, we're able to use that denture that you've been wearing and put these attachments in there, and you leave that same day with your denture snapped in. You can hear that snap.
No glue.
No glue. Snapped into those mini implants, okay? So, you know, once we've got the dentures ready, you know, set up for you that day where we put the implants in on the top and the bottom, if you like, and you'll leave with your dentures snapped in to these implants. So they can't flop out, they can't move around, you don't have to use that denture glue anymore. It just makes life so much easier, and you can chew what you want to chew. That's kind of the biggest thing, is being able to eat that steak, eat that salad, things like that with the snap-in denture. It's a great option for people.
And for those who miss the taste of the glue, they can have a tube just to kind of taste it.
Yes.
I don't think that happens. Freedom Mini Dental Implants, 571-5263. Sharon joins us now. Sharon, thank you so much for calling. Thank you for watching the show as well.
Well, thank you very much, John. I enjoy both, whoever you have on the show. I really enjoy it.
Thank you. Thank you so much.
My question to the doctor is, how do you clean them if you have them permanently put in your mouth, and how do you clean your teeth every day?
Great question. Yes. So kind of, John mentioned, we give you a water pick, like a water irrigator, and you will take it along kind of the edges here and just flush that out and keep it nice and clean, okay? I kind of equate it to, it's like a power washer for your teeth, okay? So, you know, as long as you're using that irrigator daily, and then also you're going to brush your teeth just like you would brush your natural teeth. Brush them like you know, regular teeth. And then, you know, everybody likes to use a nice mouth rinse too, just to freshen your breath and, you know, some vigorous mouth washing. But it's definitely can keep it clean with that water pick and that little irrigator that we give you. So great question.
Yeah, thank you for the call, 571-5263. And we go to Rose, who joins us now. Rose, good afternoon, and thank you for watching.
Yes, how you doing? I enjoy your show.
Thank you.
And my question to the doctor is, if you find out that you have a gum infection or something like that, do y'all treat that before you put it in?
So normally, yeah, if you have a, you know, gum infection or periodontal disease around existing teeth, okay, it probably means those teeth need to come out. And once those teeth are out, that's kind of getting rid of the source of an infection, okay? And you bring up kind of a good point with this, because a lot of people have been told they've got bone loss or gum disease, and they don't think they're a candidate for implants, or they've been told they've lost too much bone for the surgical implants. But many, many, many times we can help people with the mini dental implants. It's rare that we have to tell somebody they don't have enough bone. So even if you have that gum disease, gum infection, we can certainly help you, and implants can 99% of the time be placed. The mini dental implants can. So great question.
So really, there's nothing but good news. I've examined this with Dr. Stroud over and over, and I tend to be a little bit skeptical, as I think a little apprehensive about, okay, there has to be a downside. But Dr. Stroud, and maybe you agree with this, kind of compared it to, okay, when you used to have an appendicitis, then you would get it removed and they had to cut you open and everything. He said now it's laser.
Right.
And it's similar to that, isn't it?
Similar concept. Minimally invasive is the key. Yeah. So yeah, and the technology's been around for 10, 15 plus years. It kind of started off with they were doing the dentures, stabilizations with them, and then they started to see the success of those, and they were like, these mini implants are lasting a lot longer and working. So people are kind of transitioning away from the surgical implants into the mini dental implants, and have seen the advancements in the technology in that. And I know we'll talk about later, but you can do it for a single tooth, or just a couple teeth you're missing. Doesn't always have to be just for a denture.
Yeah, well, in fact, let's talk about that, because I think that is interesting. There may be someone who's watching now, you or a loved one, who's missing a tooth or two, and it makes them uncomfortable. They're covering their mouth when they smile. We talk about that a lot, and that's just so unfortunate. Everyone should be proud of their smile.
Yes.
It's a right. It's in your DNA.
Yeah.
So here we go. Show me the model and how it works.
Okay, so we've talked a lot about if you're missing all your teeth, but you don't. Even if you're missing, let me see if I can get it straight here, just one tooth, a single tooth, we can replace with a mini dental implant, okay? And the great thing about the mini dental implants is, same process as I described before, no incisions, no stitches, but the day we place the implant, we're able to, you'll leave with the temporary that day, but 3 weeks later, we can cement this tooth onto that implant. Versus the surgical ones, a lot of times you have to wait another 6 months or a year. I mean, that can be up to a year or longer process with the surgical implants. So you can definitely replace a single tooth. And one of the biggest places, if somebody's lost a tooth as an adult, but I see a lot of teenagers or people in their young 20s that were either born without a front tooth, and they're wearing these flippers, partials, these retainers, and when you're in high school, you don't want to be wearing a flipper and a retainer and missing a tooth,
I was weird enough.
So yeah. So I mean, that's one of my favorite things to do, is help those teenagers out, replace that tooth, and they get rid of that flipper and that retainer.
Yeah, you want them to feel confident. I mean, you're right. As a teenager, life's hard enough.
Right. Let's not add on to it. So, but yeah, we can do one tooth. We can do 2 to 3 teeth. When we do 2 to 3 teeth, we will splint the teeth together like a bridge, kind of as this model shows here. So, 1 tooth, 8 teeth, 3 teeth, whatever your situation is, we can help.
Fantastic.
So.
Yeah, I remember when I was a teenager, I had so much acne, I looked like I'd been bobbing for French fries. I needed help. 571-5263. We go to the phones and we talk to Stella. Stella, welcome to the show.
Thank you.
You have a question?
Yes, I do. I just heard, though, pretty much answered my question. I have 2 of my jaw teeth missing. I have all my other teeth, but I wondered about the process of getting 2 implants.
Yes. So kind of how I just explained, but you're right. But yeah, if you're missing just those 2 teeth, once we put the implants in, about 3 weeks later, we cement the crowns, the teeth on there. It's a really easy process. And like I said, the day we put the implants in, you really won't have any bleeding or swelling or anything like that. But yeah, we can certainly replace just 2 teeth. And one thing we haven't mentioned is I invite everyone who's interested, we do free consultations. So just give us a call and get an appointment for a free consultation, and love to take a look at your situation and see how we can help you.
All right, Freedom Mini Dental Implants, 571-5263. Gloria's up next. We're gonna take some more phone calls. Hang in there with us. Free consultation. If it seems too good to be true, there's no downside. It is too good to be true, and you can go to the Freedom Mini Dental Implant Center and feel confident about your smile once again. We'll be right back on Wave 3 Listens.
Download your app for breaking news. The Wave 3 News app, sponsored by UPS.
We've been talking about so many great deals on the Camry, the Corolla, the RAV4, the Sienna van right now during Toyota's Last Chance clearance event. Get $2,750 customer cash back. ToyotaofLouisville.com.
The people at Sam Aguiar was very attentive. They made sure that my problem was first on the list. They stayed in contact with me. It made me feel welcome.
Cherry House Furniture Galleries, your Labor Day weekend destination. Cherry House says thanks to the American workforce with 50% off MSRP. Plus, for a limited time, get 12 months interest-free financing only at Cherry House Furniture Galleries, where even the price is beautiful.
We sell trucks. I'm Tim Jones, back for Toyota of Louisville. We're on the pre-owned lot. Late model, low mileage vehicles that qualify for low bank rate financing. And this weekend, 0 down delivers. Come see us, ToyotaofLouisville.com.
And welcome back. Freedom Mini Dental Implants. Dr. Regan Ackerman is with me once again and fielding your phone calls. Before we go back to the phones, and I can understand this, everyone has a budget. We always get calls about cost.
Right.
And I know it's tough unless you have the person in your chair and you know exactly what they need.
Right.
But an overview of what the cost would be.
Right. So, you know, it's hard to give a specific number, but definitely the one thing we've kind of seen is, especially compared to the surgical implants, we are usually about half the cost of that, definitely, I would say. Yeah, we have lots of patients that come in and have had, you know, quotes from other dentists or whatnot, or there's another treatment out there called All-on-4 and things like that. But definitely we're about half the cost of the surgical implants, you know, per tooth, for the cemented version, snap-in denture, things like that. So, you know, it definitely is less costly. And that's another reason I love what I do, because I can do something within somebody's budget and that they can afford.
Yep.
So.
And consultations are free, so if you'd like to come in and find exactly what your cost would be, I encourage you to give them a call at Freedom Mini Dental Implants. We go back to the phones and talk to Gloria. Gloria, thank you for watching. Welcome in.
Thank you. Love your show.
Love you back.
Okay, my question is, I have like 14 teeth plus 3 probably needs cut out. Do y'all do that beforehand? Or do I have to go to another dentist?
So we do refer you to an oral surgeon for the extractions. That is the only thing we don't do in the office. Everything else, start to finish, is done by me in the office. But we would refer you to, you know, if you have an oral surgeon you're comfortable with, or the one that we work closely with. So that is the one thing that you would go somewhere else, is for the oral surgeon, and that's just because they're really good at their job. They do a good job extracting teeth. So.
There we go. There we go. I hope that's your answer there for you. And if you have a question, 571-5263. We go to Rhonda. Rhonda, good afternoon to you. Hello, Rhonda. We may have lost Rhonda. Sound like I heard a little click there.
Hi there.
There she is.
Okay, my question is, broken dentures. Can you get just the top plate of broken dentures? Because over here in Indiana, they tell me that you have to have the top and the bottom.
So, depending on what your situation is, you know, if you just want an upper denture, we can do just an upper denture. If you already have a lower denture that you're happy with and you just want an upper denture, if that one's broken and you're just, you know, need a new upper denture and want to, you know, do something with implants where it'll stay in better, then yes, we can definitely do that. I treat a lot of people where we just do, you know, either the top or the bottom. So yeah, we definitely can do that. That's not a problem for us. So.
Thank you for the call. Let's try to squeeze another one in here and talk to Cheryl. Cheryl, good afternoon. Welcome to the show.
Hi, thank you for having me.
Of course. You have a question?
My question is, I have a partial bridge, 8 teeth on top, that I've had since I've been a teenager. I've had some bone removed up there as well. A couple of years ago, I had that periodontal infection, and I had my teeth all taken care of for that, but there's a lot of receding there. Without that bone up there, am I a candidate for a the implant, or does that not work with someone with no bone up there in the front of those teeth?
So, I mean, of course, I'd love to see you in the office and see for sure. But like I kind of said before, a lot of times, even with the gum recession and the periodontal disease, we still have enough bone for the mini dental implants. We don't have to have a lot of bone, just some bone. So even if you've been told that before, I invite you to come to, see me and let me take a look, because chances are you are a candidate, even with bone loss and gum recession. Because a lot of people think even though their gums have receded, there's still a lot of bone hiding underneath there, and enough for me to do what I need to do. So that's a great question.
Yeah, so. And you and both Dr. Stroud have both said it takes just very little, and it's rare that you find someone who doesn't have enough. Right.
Yeah, I had a patient we saw a few weeks ago. She'd been wearing a denture pretty much since high school, and she's probably in her 60s now, and she didn't think she had any other options. She'd just been struggling, and her bone on the bottom was almost flat, but she actually ended up getting the permanent teeth option, and I mean, it's just been life-changing. She's like, I wish I'd found you all 10 years ago. Where were you? We were like, we've been right here. So yeah, I mean, even those denture patients, you've been wearing a denture for 20 years, and I know a lot of you all don't go to the dentist anymore because you have your dentures and you just think that's what you have, but there's still this option out there for you if you're struggling with that denture. So.
It is truly life-changing. Freedom Mini Dental Implants. Give them a call. The consultation is absolutely free. I love this story because I said this to Dr. Stroud, and I love telling you because you'll have the same kind of response. He said, when I practiced general dentistry, he said, I didn't get a lot of hugs and kisses for a root canal.
Right.
He said,
nope.
But you wouldn't believe after I've changed someone's life with Freedom Mini Dental Implants, right?
It's so rewarding, and we have wonderful patients, but it's true, because when you can change somebody's life and they can eat what they want to eat and smile, we get hugs and they become our friends instead of, they don't not want to come see us because they're dreading the root canal or things like that.
Is that your new buddy right there?
That's my new buddy, yeah. Me and John.
John looks fabulous. Yeah, I think, what's amazing to me, and we have before and after pictures every time that you come on with a case, is that it erases age as well.
Definitely.
It's kind of odd. I don't know if it's just because teeth are a sign of youth, I don't know, or it's just because the wrinkles kind of disappear when you fill your mouth out. I guess all of the above.
Yep, and just their self-confidence and mentally, I think, too. It erases some age there, too, as well. So, yeah.
Again, free consultation, Freedom Mini Dental Implants. Give Dr. Ackerman a call. She'd love to take care of you. And as I said, if you've been told before, you're not a candidate. Yes, you are. It's very rare that there's not enough bone. So again, give them a call for a free consultation. We're going to take a quick break, and then we'll be back and say goodbye along with Dr. Regan Ackerman, Freedom Mini Dental Implants. Wave 3 listens.
If your loved one has been injured or is being abused or neglected in a nursing home, there is something you can do. Call the Nursing Home Injury Hotline at Hughes & Coleman.
There's a reason everyone around here complains about allergies. They're bad. But family allergy and asthma can build up your immunity to what makes you miserable, ending your suffering for good. No more symptoms means no more complaining. Family allergy and asthma.
I got involved with Morgan & Morgan through my relationship with John Morgan, who's been a long-term supporter and friend of the Kennedy family, mainly because I admire John because he's a fighter, and John, over the past 30 years, has assembled 400 of the best litigators in America who he handpicked because they're not scared of litigation, because they are battle ready, because they're trial ready, and he picked them because he cares about people.
Shannon Cogan, weeknights on Wave 3 News.
One more quick point by Dr. Ackerman, if you would.
Yes. So I get asked all the time if a patient's on a blood thinner, if they have to be taken off their blood thinner. And no, the answer is no. This is so minimally invasive. We do not have to take people off medications ever.
Fantastic. All right, give them a call. Freedom Mini Dental Implants. We'll see you tomorrow on Wave 3 Listens Live.